Hello everyone, and welcome back to the menagerie. Today's monster used to charge people $25 to commit his atrocious actions upon them, and was heralded as a savior of the mentally ill for many years. Walter Jackson Freeman II was born on November 18, 1895. During his academic career, mental health treatment was in an abysmal state worldwide, often taking a person with benign psychological afflictions or no issues at all, and taking away their humanity piece by piece. In essence, asylums were prisons and torture chambers for the mentally ill, or simply those thought of as mentally ill. In this abysmal state, Freeman became seen as a savior for mental health, first by conducting prefrontal lobotomies in conjunction with neurosurgeon Dr. James Watts, starting in 1936. However, in 1946, Freeman developed and used the trans-orbital lobotomy. It was known as the ice pick method because Freeman first experimented with the procedure in his own home with an ice pick and a grapefruit, then with cadavers, and then finally trying it on living patients. The procedure was fast. It quickly caught on through Freeman's efforts in promoting it in asylums across the United States, and soon became widely popular as a form of treatment for issues ranging from schizophrenia to depression. This allowed Freeman to work on his own outside of surgical settings, turning an intensive surgical procedure into a 10-minute process of driving a pick into the brain through the eye socket. By 1950, Dr. Watts cut ties with Freeman due to his unethical practices, namely the cruelty and overuse of the procedure. That being said, here are some broad strokes to give you an idea of how horrible this man was. He performed the procedure on at least 19 minors, including a 4-year-old child. One victim of his, 12-year-old Howard Dully, wrote a book about his long recovery, and it's one of the most disturbing things I've read in a long time. Freeman promoted this procedure as a showman, salesman, and entertainer, not as a doctor, and certainly not assessing the need for the procedure on a given patient. It was like a snake oil salesman with an ice pick and a mallet. He did not use gloves or a mask while performing the procedure. Many times, he would re-perform the procedure multiple times on a single patient. Through all of this, the procedure was mostly ineffective, often severely damaging or outright fatal to the patients, with roughly 15% of attempts being fatal. Finally, in 1967, he was banned from conducting the procedure anymore after killing a patient with a cerebral hemorrhage while conducting their third lobotomy. 5 years later, he died from complications due to cancer at the age of 76. He will not be missed. If you found this interesting, please feel free to subscribe. Thank you for your time, and I'll see you next time.